Hello everyone, I am Jam Chelsea Fayan Velarda, and for today I am going to perform an eye assessment. But since I don't have any background about my patient, the first thing that I need to do is to review my patient's previous medical record. Okay, so now that I have an enough background about my patient, allow me to share to you the things that I have prepared for this assessment. The first thing that I prepared is the Snellen's chart. So this is used to check for visual acuity of my patient. And next is the opaque card. This is used to cover the eyes which are tested. And next is the pen light, of course, a ball pen, and a jot down notebook. And lastly, the alcohol. So it is very important to sanitize our hands before we deal with our patient. Okay, so now that we're all set, let us meet my patient for today. Oh, I think my patient have just arrived. Good afternoon, ma'am. Please sit here. Yes. Okay, so now that my client is just on time for this assessment, the first thing that you need to do is to greet the client, just like what I did, and then to introduce yourself, identify the client's identification, ask for her name, her birthday, and confirm it on the wristband that she is wearing, and ask what you want to be called during this assessment. Hello, ma'am. I am Jam Chelsea Velarda, and I'm going to be your student nurse for today. May I ask what is your name, ma'am?
Vines Linares,
Goodness. When is your birthday?
July 28,
Okay. May I check your wristband? Okay. Ma'am, may I ask what you want me to call you during this assessment?
Kaina.
Miss Kaina. Okay. So the next thing that you need to do is to explain the procedure to the client and how she can participate to this assessment. And also, it is very important to ensure the privacy, the confidentiality, and the comfort of the client. That is done to establish rapport with your patient. Okay, so Miss Kaina, what we are going to do today is I'm going to be assessing for your eyes, okay? I'm going to be checking for your vision, and I'm going to be assessing for your external eye structures, particularly your eyebrows down to your eyelids, okay? Don't worry because this won't take long. Maybe this will only take 15 to 20 minutes, okay?
Okay.
All I ask you to do is to follow what I instructed you, okay? Is that okay?
Yes.
Okay, so do you feel comfortable now, or do you feel cold? Do I need to adjust the air conditioner for you?
No.
Okay, so do you have any question before we start?
No.
Okay, very good. So now that my client is all ready, let us now start for assessing her visual acuity. So what I'm going to do here is I'm gonna position the client 20 feet away from the Snellen's chart, and I'm gonna ask her to read the line that are visible for her, and using this opaque card, I'm gonna cover her one eye to test. Okay. Now let's start. Miss Kaina, can you please transfer here? Can you please read the line of letters that are visible for you?
Number 8, Befpotec.
Okay, can you please cover your right eye?
Befpotec.
Okay, now your left eye.
Befpotec.
Okay, very good. Okay, so the client has a 20/20 vision. Okay. And after that, if defect is detected, if the client cannot read the top line of the Snellen's chart, it is very important to perform the 3 selected test, which is the light perception, the hand movements, and the counting fingers. So now I'm gonna demonstrate how to do it. Okay. Miss Kaina, I want you to face me. Okay, very good. So now I'm gonna ask you to tell me how many fingers I am raising right now. Okay.
3,
How about this one?
4,
How about this one?
1,
This one?
5,
Okay. Now tell me where are my fingers are pointing. Okay.
up,
This one.
down,
This one.
left,
This one.
right.
Okay, very good. Now, if the client cannot identify your hand movement and your counting fingers, just go nearer to the client until she can identify the movement of your hands. Now, let us check for light perception. Okay, I'm gonna use a pen light for this one. Now, Miss Karina, tell me if where the pen light is located. Okay, can you tell me? Where is it?
Down,
How about this one?
left,
How about this one?
up,
This one?
right.
Okay, very good. So that's it. Now let's check for the patient's visual fields. Now what I'm going to do here is I'm gonna position myself 2 feet away from my patient, and I'm gonna place my hands 2 feet laterally on my patient's ears, and I'm gonna ask her to tell me when she first spotted my fingers wiggling. Okay. Now, Miss Kaina, I want you to please move here. Move here. A little bit more. Okay, can you please? One more. Yeah, like that. Okay. I want you to tell me when you first spotted my wiggling fingers, okay? Okay, now look straight to my eyes. Okay. About this one. How about this one? Okay. Now, if a defect is detected, it is very important to repeat the procedure into the defective eye. Now, let us assume that my client has a defect on her right eye. Okay, I'm gonna repeat the procedure on her right eye. Okay. Okay. Tell me when you first started. How about this one? How about this one? Okay. Now I'm gonna repeat the procedure to her accompanying eye. Okay. How about this one? Okay, this one. Okay, so that's how you do it. Now let us proceed into the assessing the external eye structures of my patient. So the first thing that I'm gonna assess is her eyebrows. Okay. Now, Miss Kaina, can I touch your face? Okay. Can you please raise your eyebrows for me and put it down? Okay. Can I see your eyes? Okay. So the patient's eyebrows is evenly distributed both on the left and the right. The skin is intact. The eyebrows are symmetrically aligned with each other, and it moves equally. And also, the eyes, I observe that it is symmetrically aligned with each other. Now I'm gonna proceed into assessing my patient's eyelashes. Okay. Now, Miss Kaina, I want you to close your eyes for me. Okay, I check. Okay, another one. Okay, now open. Okay, so the patient's eyelashes are equally distributed, and it is slightly curled outward, which is perfect. Now let us check for the patient's eyelids. Okay, now Miss Kaina, can you please raise your please, right? Now I want you to close your eyes for me. Yes, very good. Now open. Check your left eye. Right eye. So the patient's eyelids are the skin here is intact, no discharge, no discoloration. The lids close symmetrically. There are approximately 15 to 20 involuntary blinks per minute, and also when her lids are open, there are no visible sclera above the corneas, and the upper and the lower borders of her corneas are slightly covered. Now let's proceed into checking the patient's bulbar and palpebral conjunctiva, including her iris and her pupils. Now, Ms. Karina, can I touch your face? Please look up for me. Okay. Up. Okay. Now I'm gonna pinch. I'm gonna check for your palpebral conjunctiva. Okay, I'm gonna pinch slightly. Okay, good. Okay, so the the bulbar conjunctiva of the patient is transparent. The capillaries are often evident. The sclera appears white, smooth and shiny. The details of the iris are evident, and also the pupils are located centrally on the patient's iris. Now let us check for lacrimal gland and lacrimal sac. Now, Miss Kaina, can I touch your face again? Okay, now close your eyes, please. Okay. You feel anything?
No.
How about this one?
No.
So the patient didn't feel anything, and I didn't palpate any swelling. So the lacrimal gland and the lacrimal sac is good. Now let us check for the patient's corneas. I'm gonna use the pen light. I'm gonna shine a light obliquely onto the patient's eye to check for opacity and texture. Now, Miss Kaina, I want you to look into the distance, okay? Okay, the other one. Okay. So the corneas of the patient are translucent and smooth. Now, let us proceed into checking the patient's direct and consensual papillary reaction to light. What I'm going to do here is I'm gonna dim the room, and I'm gonna ask the client to look onto a distance, and I'm gonna shine a light to the patient's eyes, obliquely into the patient's eyes, and I'm gonna look for direct and consensual response. Okay? Okay? Okay. Just look into the distance. Okay, another one. Other eye. Okay. So the pupils of my patient is constricts when which is the illuminated pupils of my patient constrict, which is the direct response, and the non-illuminated pupils of my patient constrict, which is the consensual response. And the response is brisk, which is good. The size of the pupils is 6 centimeters. Now let us proceed into the eye accommodation. Now what I'm going to do here is I'm gonna position myself 2 feet away from my patient, and I'm gonna use this pen to place it 4 inches away from my patient's face, and I'm gonna ask her to look directly onto the tip of this pen and look into the distance and alternate what she is doing. And also I am gonna ask her to look in this again, and then as I move it towards the bridge of her nose and look for eye accommodation. Okay. Now, Miss Kaina, I want you to look at the tip of the pen, okay? Okay, now and look to the distance. Now alternate what you are doing. Okay, very good. Now continue continue looking at the tip of the pen as I move it towards the bridge of your nose, okay? Okay. Okay, so the pupils of my patient constricts when looking at the near object, and it dilates when looking at the far object. The pupils of my patient converge when as I move the near object towards her nose. Okay, now I'm gonna light the room. So now let us proceed to the Hirschberg test. Now what I'm going to do is I'm gonna position myself 2 feet away from my patient. I'm gonna shine a light directly into my patient's face, and I'm gonna ask her to look at the light, and I'm gonna look for direct and consensual response. Okay, Miss Kaina, I want you to look the light, okay? Okay, so Okay, so the reflection of the light to her corneas are symmetrical or in the same spot. Now let us proceed into the cardinal fields or of gaze test or the extraocular muscle test. Now what I am going to do here is I'm gonna position myself 2 to 3 feet away from my patient again, and I am gonna ask her to follow the movement of my hands as I write a wide letter H on the air. Okay, and I am gonna ask the client to watch for a rim of sclera or a jerky movement of nystagmus, and as the eyes move up and down. Okay. Now, Miss Kaina, follow the movement of my hands, okay? Again. Okay. So, okay, I'm sorry. Okay, so both eyes coordinated well. They move in unison with parallel alignment. Now let us proceed into checking for eye convergence. Now what I am going to do here is I am gonna put this pen 4 inches away from my patient's face, and I'm gonna ask her to look directly into this tip, and as I move it towards the bridge of her nose. Okay. Please look at the tip of the pen. Okay. Continue looking at the pen. Okay. Okay, so the pupils of my patient converge as I move the near object towards the bridge of her nose. Now, this phase, I am gonna summarize the information that I have gathered during this assessment, and I'm gonna discuss any health concern if present, and also I'm gonna assess for my patient's understanding and ask her if she has any concern or clarification before I end the assessment, and thank her politely. Okay, now Miss Kaina, can you please transfer here? Okay, so I'm gonna summarize my findings. Okay, now I observed that you have a 20/20 vision. Okay, so good, everything is good, everything went well. I didn't find any suspicious at all. So I want to commend you for doing that, for having a 20/20 vision. Okay, so just continue what you are doing. Be responsible in using your gadgets. Okay, do not overuse. Okay, do not abuse your eyes. Is that okay with you?
Yes.
Okay. So now, do you understand what I said, or do you have any question, clarification before we end this assessment?
No.
No. Okay, so thank you very much, Miss Kaina. Okay, thank you for being so responsive and for being cooperative. Okay. Okay. So I want you to wait for me there. I'm gonna attend to you later after this. Okay.
Yes.
Okay. Thank you very much. So after that, I am gonna document the findings that I have gathered for this assessment. Okay, so after documenting, it is very important to sanitize our hands after the assessment.